Hi, everyone. My name is Evan Varation, and I'm the coordinator of the Clarence Central School District Family Support Center. And as we kind of continue in our school year, and as we continue as a family support center providing services for the district, we also want to make sure that we're providing, and there's a bell, that we're providing as much education for caregivers and parents and community members as we can on topics that we know might be relevant to you. Uh, so today we're going to have an interesting conversation with the person that's with me right now, who I'll introduce in just a bit. But what we really want to consider is that, for anybody who's been living in the past decade, even those that are relatively young, so thinking about even some of our elementary students, the ubiquity of social media in our day-to-day lives can't be overstated. Even for those who might not have accounts or be particularly personally active on social media, it's hard to escape its influence on how we engage with the world. Over the past few years, there's been more research and discussion focused around the impact social media is having on the social and psychological health of individuals and communities. In particular, there's a strong push for more examining of the impact of social media on mental health, of which we could devote an entirely separate conversation to. And despite the fact that there is often a precipitative link between our physical health and its impact on our psychological well-being, there's been limited research on the specific impacts of social media use and our physical health. Our speaker today is one of the few folks spearheading research on such matters, and also happens to be doing so right down the road at UB. So we're fortunate to have Dr. David Lee with us today, who's currently an assistant professor in the Department of Communication and a faculty associate in the Department of Psychology at the University at Buffalo. Having such experts right in our backyard is something that our office does not want to take for granted. So we are hoping that we can continue to build partnerships with our institutions of higher learning and folks like Dr. Lee to further the education that we can provide our community here in Clarence. Dr. Lee's research and background has focused heavily on social psychology, and there's probably never a time where that's going to be more important for us to gain more insight on. And what I found most intriguing, Dr. Lee, is that some of your research even dates back as far as 2013 on some of these issues related to social media use. So considering where we were with regard to social media back in 2013, which seems almost certainly more than 12 years ago, it almost seems like 30 years ago based on kind of how far we've come with regard to social media platforms and smartphones. I think, again, I just feel so privileged that we have someone in our backyard who's been able to research on some of the stuff and share with our community today. So I'll leave it to you, and hopefully for those who are listening and watching, this will be beneficial. We will have this presentation on our YouTube channel timestamped. So if you do want to just scroll through as you're listening to this to particular sections, I'll make sure that it's time-stamped so you can find the areas of the presentation that might be most relevant for you.
Well, thank you for the wonderful introduction. Let me quickly share my screens. All right, how are you doing now? Well, thank you again. I'm really happy to be here having these meaningful discussions surrounding a really important topic. And I hope to learn a lot about the day-to-day issues that our parents, staff members, and students are quite dealing with every day as well. So again, my name is David Lee. I'm at UB, and today I wanted to talk about a brief sort of overview, review of the current research and future directions on this social media use and well-being research. I'll also talk about some of the physical health aspects towards the end as well. Okay, so a recent Surgeon General report has highlighted some seriousness of the current mental health trends among our youth. In this report that was done in 2021, it said, for example, from 2009 to 2019, proportion of high school students reporting persistent feelings of sadness or hopelessness increased by 40%. Those seriously considering attempting suicide increased by 36%. Those reported creating a suicide plan increased by 44%. That comes out to be 1 in 6 students. I typically want to start my presentation on a positive note, but unfortunately, I apologize that today is not, for that. But what it does highlight is, the current trends, right, in terms of mental health among our youth. And the question is, though, why is this the case, and what might be responsible some of these trends? And of course, a lot of things have happened in the past decade, but one common hypothesis that many scientists have talked about is the potential role of social media use or time spent, right? That could be driving some of this trend. And their argument seems to hold some truth when you look at data like this. So on the left, you see is amount of social media use and depression, or lower psychological well-being, the relationship between these two variables. So on the red one, focusing on the girls, you could see that there is a positive association, right? So the more social media use, higher likelihood for depressive symptoms or more lower well-being. Similar things, although at a weaker effect for boys. And same thing for smartphone use and lower well-being. On the right, if you focus on zero in on teenage girls, you could see that something drastic happens around 2012, around that area, right? You could see this huge increase in depressive symptoms, right? The red line here, and also, coinciding with social media use as well as internet hours, right? So suggesting that social media use, at least partly, might be responsible for this role in the mental health declines. Now, of course, probably not the first time you've heard something like that, and the media are all over this. And I'm sure you've come across an article or a news segment on this topic, some comparing smartphone to cocaine or Instagram being toxic and so forth. So, and this is also has gotten attention from the policymakers and of course the broader public as well. On the other hand, though, other scholars remind us that, hey, this is not the first time that we've reacted this way about a new media technology. And they question whether we might be overreacting or too soon to come to a conclusion. So, for example, in the late 1800s, when the telegraph was invented, there was some fear that it was going to replace in-person relationships or interactions. Similar reaction when the telephone became popular. And more recently, we wrestled with the question whether, it's the internet making us less social and less happier, things like that. So a key question, considering all of this, is what is the role of social media in well-being? So with this in mind, my goal today is to provide you with a very brief overview, of the social media use and well-being research. But before I do that, I'd like to mention a couple of things here. So first, the social media use well-being research area is one of the most active, and it's getting even hotter, I should say. And it's drawing interest from a variety of disciplines, from psychology to communication to public health and so forth. So, but one thing is that it's still, by science age, it's considered relatively young. So what that means is that we don't yet have scientific consensus on a lot of the issues. And also, given the importance of this topic, you want to do good science, and good science is typically slow and it takes time. And unfortunately, what this means is that scientists often lag behind the latest tech developments, right? It's just always changing, right? So, and I understand this can be quite frustrating for the public who will want to hear clear, unambiguous answers to things that matter to them, frankly, on a daily basis. So what I'll try to do is I'll try my best to integrate a wide range of studies and provide some general pictures so that you could decide how to use that information into your life and those for those around you. And I'll try to be as unbiased as I can be. So the research method I will rely on is the quantitative social scientific approach, which is one of the most widely used approaches studying this topic. So this means that I'll be summarizing studies that rely on hundreds of thousands of research participants on their social media use and their well-being, and focus on the aggregate association between these two variables rather than the singular experience of each participant in the study, like a case study, for example, would do. So the advantage of this approach is that by decontextualizing and focusing on the general link between social media use and well-being, that'll allow us to apply these general lessons learned to a wide variety of different situations. However, it also might mean that these lessons are accurate for the whole, so may not perfectly align with every individual's experience. So there's some caveat there. Similarly, given this general approach, I'll focus on social media, typical social media, and mundane social media use. So the typical scrolling and typical texting and posting and things like that, and its impact on well-being, rather than a particular type of usage, right? Social media used to spread hate or harm others, cyberbullying, and so forth. Okay. And given the limited time, I'll focus on well-being outcomes broadly defined as how people feel and how they evaluate their life as a whole, and also some physical health outcomes. And I won't have time to cover other interesting things like academic achievement or body satisfaction and things like that. Okay, so here's what I hope to cover today. First, I'll introduce some initial research on this topic, focusing on questions such as, does social media use influence well-being? What are some beneficial or detrimental ways of using social media? And I'll also cover some recent work. Some of these were built on each other. So does social media use influence physical health? Who benefits versus suffers from social media use? And finally, I'll provide some guidance on how to think about the role of social media use in daily lives and introduce what types of research you could expect in the future. So one of the very first questions researchers wanted to know when social media became really popular was that, is this technology good or bad for us, right? So many initial studies sought to answer this question: does social media use influence psychological well-being? So let's take a look at some stats. And the most basic way of looking at social media use is to look at time spent on social media or on the smartphone. And a recent survey shows that over 90% of teens are online several times a day, with about half on it almost constantly. Gen Z spends about 4 to 5 hours per day on social media, and you could probably imagine that if you look at smartphone usage in general, that number will go up a lot more. And it's not just young people. American adults spend about at least 2.5 hours per day on social media. And just to give you some context, this is on average. American adults spend about just about 20 minutes for exercising or sports. Spend 40 minutes hanging out with friends face to face daily, on average, and 70 minutes for eating. Right. So clearly, we're spending a lot of time on social media and smartphone. So given so much time spent on social media, the initial hypothesis was based on what's called this displacement hypothesis, which says that social media use can undermine well-being if time spent on it replaces activities that are supposed to promote well-being. So things like sleep, exercise, in-person, face-to-face interactions. You could see how if you're no longer doing the things that make you happier and healthier because you're spending so much time on social media, it could eventually lower your well-being, right? And note that this is saying that even if the typical social media experience itself, whatever that might be, is neutral, just by replacing other good things, it could negatively impact well-being. Another way social media can influence well-being involves this positivity norm in the social media environment, right? So one of the advantages of social media is that it allows you to present the best version of yourself, right? Everyone's done their hair, makeup, looking sharp, achieving great things, and going to the best vacation spots and posting it, right? That's fine and all, but what ends up happening is that because people are exclusively almost, right, disproportionately posting positive things about themselves, social media environment becomes inundated with positively biased self-content. What this might do, especially for adolescents who are very sensitive to peer norms, pressure, and comparison, is that it could trigger people to compare themselves to others. And now, don't get me wrong, people compare themselves with others all the time. However, the comparison on social media happens to be the overly positive version of my friend, for example, which has been curated, edited, and carefully crafted versus the typical me who's doing the scrolling, right? So everybody loses this comparison, right? And you could see how this might eventually make you feel like your life isn't that great, you're not as attractive, and you're not achieving great things by comparison. And interestingly and unfortunately, we find that this effect is so robust that even this happens even when we know that the contents that we see might be edited, filtered, and carefully crafted and biased. Even if we tell our research participants, hey, this might be, you know how things work, right? This might be doctored, this might be filtered, right? But still, this social comparison effect happens, and then the downstream consequences of feeling bad about yourself, that still happens. Finally, there's this notion of digital stress that it could undermine well-being because parents know this, we know this, social media is technically never off. So this creates this norm where people experience this pressure to be always available online and be responsive to text or check out what's going on all the time, right? So maybe the kids might not want to be on social media at the dinner table, but what are you going to do, right? Everybody else is on it, and you don't want to miss out, right? This is a very powerful, strong motive for everyone, but stronger for adolescents, right? So social exclusion or the possibility of that is very, very real and strong. Finally, people may simply be overwhelmed by the sheer amount of information, news, notification, and data in general. And this is something that continues to come up whenever you survey adolescents about, they just get inundated with information. And there's some perspectives that argue that that could also cause stress. So how do you test the impact of social media use on well-being? I'll cover a couple of different ways. One of the most effective ways is through what's called the experience sampling method or ecological momentary assessment. Basically, in this method, researchers text participants several times a day randomly and get their responses to things like, how do you feel now? Or how much have you used social media platform, in this case, I guess, Facebook, since the last time we asked. The idea is to get a lot of these responses per each person and use that data to understand how social media use at one time point would predict how people would feel subsequently. So in one study, we found that using Facebook, this is the 2013 paper that I've mentioned earlier, but data collection began in 2010, so it kind of dates us. But we found that using Facebook at one time point predicted feeling worse subsequently. So if you use Facebook a lot from 9 a.m. to 11 a.m., there was a greater chance that you were going to feel worse at 11 a.m. when we contacted you. Same thing if your Facebook or similarly use decrease from 11 to 1, when we contacted you at 1 p.m., there was a greater chance that you're going to feel better, right? So these findings all were also replicated in many other studies using similar methods on different platforms. And it really gave us the initial evidence that social media use may undermine well-being. Another convincing piece of evidence comes from a set of studies that use an experimental method. Typically, in these studies, I call it social media abstinence studies, they randomly assign set of participants into one of two conditions. So, in one condition, participants will be instructed to either limit or completely take a break from social media for several days. In the other condition, participant in general will use their social media as usual. At the end of the study, researchers will compare these two conditions on things like depression, anxiety, loneliness, or other well-being outcomes. And in these studies, typically what they find is that people who've abstained or limited their social media usage compared to those who used it as usual often report feeling better and enjoying higher levels of well-being. Now, you might say that at this point, aren't there some benefits of using social media, right? I use it to talk with my friends or keep in touch with distant relatives and things like that. So true, right? After these initial studies, a more nuanced argument started to come about, and it's something like, hey, it's not that social media use is always bad, but it might depend on how people use it. So, what is this how part, right? So, in one example, researchers have categorized two common ways in which people use social media. So, passive use is when people consume information without directly communicating with others. So, it's just scrolling through content and looking at people's pages and pictures and without a specific purpose. And recall that in general, social media environment is positively biased. So if you're constantly reading about how great everybody else's life is and their success stories, there's a good chance that you might feel jealous and not feel great about yourself. In contrast, researchers have found that active use, that is directly communicating and interacting with others through messaging, and commenting on people's posts and things like that, and that could help build more supportive relationships and also lead to more receiving of social support that is good for well-being. So, in one experiment, we tested how passive and active use influences well-being. Here, we recruited participants in the lab and simply instructed half of them. Let me show you. First, we asked them, how do you feel now? And then we had them use Facebook, half of them passively, and the other half use Facebook actively for 10 minutes. And then we assessed how they felt immediately after their Facebook use and also at the end of the day, the idea is to get a sense of, okay, how do they feel throughout the day? So, what happens when people use social media or Facebook passively versus actively? On the y-axis, this is emotional well-being. So, higher on this axis means that they feel better. Lower means they feel worse. And we've measured how they felt across time. You see that our passive condition participants gradually feeling worse, right, throughout the day, right? However, that wasn't the case for our active social media users, right? And you could see that the difference at the end of the day is statistically significant. So we could say that the difference in how they feel is really due to the two condition being different in terms of the instruction they gave during that 10 minutes. So does social media influence well-being? If you want a simple answer, yes, and it seems to undermine well-being based on this initial set of studies. But more nuanced answer is that it depends on how you use it, right? So if you endless scrolling without a specific purpose might not be good for you, but active use and using it to communicate and build relationships can be beneficial and can buffer you from some of these detrimental effects of passive use. Now, recent research has built on this initial set of work to explore the role of social media in many ways. And yes, I don't have the time to cover everything, but I'll highlight some of this coming from our team at UB and our institution. So the first is the role of social media use and physical health. Now, my collaborators and I got interested in the potential impact of social media use on physical health for multiple reasons. So the evidence seems to suggest at the time that, okay, there's some linkage between social media use and mental health. There's an influence there. Um, there are also decades of research showing that the mind and the body are connected, meaning a close link between mental and physical health. Just a quick demonstration, because this is a separate research area on its own, of this broader idea. In one study looking at the brain, they found that the same region of the brain that was activated for emotional pain and physical pain, so the same area was activated for emotional and physical pain. So that suggests that our mind and our body are more intertwined than typically thought, right? The brain does not reserve a specific process or space for mental health here and physical health here. Rather, they might share more overlap. So logically speaking, right, social media use to mental health to physical health, social media use might have some linkage to physical health. In addition, we call that displacement hypothesis, right? The idea that social media use can undermine well-being if it replaces healthy activities. Well, it turns out that the very things that impact our psychological well-being also impact physical health. Things like getting good sleep, right? Doing exercise, healthy diet, right? All of these things are central to maintaining optimal physical health. Moreover, we've also talked about how the social media environment, whether it's coming from the social stress or the digital stress, can influence processes central to health. A lot of research has shown that these everyday stressors can influence physical health. And unsurprisingly, we now find in multiple studies that excessive social media use among college students, we haven't, tested on other samples yet, but at least with college students, we're seeing that it is associated with lower quality and quantity of sleep, more fatigue, more somatic symptoms. These are headaches, back pains, and things like that, chest pains, and more visits to the doctor's office and healthcare, right? And these studies relied on what's called self-report measures in research. So that is, we ask participants to report their symptoms and their behaviors. This usually means that our participants are aware of how they feel, aware of their symptoms. However, that might not always be the case. Sometimes social media use's impact on health can be found in a more subtle way, for example, in the blood as well. Okay, so before I talk about this study, I also wanted to provide some quick background information about inflammation. You might say, well, why inflammation? Inflammation is a part of the immune system, originally evolved to help us defend against injuries and pathogens. So when you get a cut and it gets infected like this, the body starts to deal with this by inducing swelling, redness, or even pain at the infection site. When we get a cold or the flu, you might sneeze and cough, right? Or you might just be very tired. And this is also the body's process of fighting off the viral infection. Interestingly, though, it's now believed that inflammation is also responsive to psychological stress and threat. So if you get sick after arguing with your spouse, or if you get sick after a breakup, inflammation has likely played a role in that. Now, in the short term, these symptoms triggered by inflammation are considered to be adaptive by allowing the body to heal and rest and recover. But inflammation, if it persists over a long time and become chronic, it could cause some serious health problems. So, for example, chronic inflammation causes 8 of the top 10 diseases leading to death in the US. So things like cardiovascular disease, cancer, and diabetes, things like that. And you might say, okay, that's great, but we're talking about adolescents here or healthy younger adults, right? So how is this relevant? Well, it's relevant because chronic inflammation earlier in life can predict the onset of these diseases years later in life. So if inflammation is responsive to stress, psychological stress, and given that we've been talking about how social media use is also associated with stress at different times, you might expect some linkage between social media use and inflammation. So to test this idea, we looked at how college students' social media use over 5 weeks is associated with their inflammation levels over time. And to measure their inflammation level, we collected their blood sample and correlated that with their social media use provided by their iPhone's screen time function. So this is a more objective, better measure than asking people to recall how much did you use, which can carry some bias. Two findings emerged. One was that social media use predicted higher levels of inflammation, meaning that higher social media usage is associated with higher levels of inflammation. Second, social media use over the 5 week study period was responsible for the increase in inflammation levels during the same period. Okay, so now, does this mean that our participants' social media use made them sick in bed? No, these are still relatively lower levels that can go undetected in daily life. The symptoms are supposed to be mild, and some might not even recognize if you are healthy. But again, it's important to remember that inflammation, even when it's mild, if it persists, right, if it becomes long-term and chronic, it can be a problem down the road, right? So more work is needed in this area, but combined with the findings earlier, this shows that social media use can impact our physical health. And we're currently working on a study that includes additional biomarkers of health. So things like heart rate variability, blood pressure. We're also getting stress hormones and other things. So we hope to get a better understanding soon. Okay, before I close, I also wanted to show another line of research being done in this area, and this one is focusing on the idea that social media experiences differ for different people. So in one representative study, researchers noticed some interesting patterns. So what they found and what they noticed was that for 20% of their study participants, they found that there's clear indication that social media use is making them feel worse. Um, and then they also noticed that another 20% is reporting that, hey, social media use is making me feel actually better. And then they found that for 60% of their participants are reporting that social media did not decrease or increase well-being. It was a sort of a wash effect, right? And this sort of type of analysis had not been available, but now with the advancement of the methodological tools we have, we could really look at and zero in at the individual level. So they went to emphasize that the impact of social media use on well-being may be specific to different people, right? So does this mean that maybe up to 80% of the population, there are no harm of social media use? Well, maybe, but also means that 20% is vulnerable to whatever this negative effect might be, right? So if you extrapolate this, let's say there are 40 million adolescents in the US, this means that nearly 8 million American adolescents are vulnerable to mental health problems due to social media use. So this is not a finding showing that, okay, 20% good, 20% bad, and 60% nothing, so we shouldn't take this seriously. We should take the 20% seriously. And I think the more productive question then is, who are these people who benefit or suffer from social media use? Right? What are their characteristics and how can I know? And research is being done now to get at this question. So I'll highlight two candidates coming out of our lab. One is participants' level of self-esteem as a personality factor. So in our work, we found that self-esteem, that is how positively you evaluate yourself, general, is an important personality factor that could change how social media use impacts well-being. So in this study, we found different patterns, drastically different patterns among people with different levels of self-esteem. This looking at inflammation levels again, so the higher inflammation, generally not good, right? So for our low self-esteem individuals, the red line here, using more social media led to higher levels of inflammation. However, for our high self-esteem individuals, the opposite pattern occurred, right? The more they used social media, the lower level of inflammation, right? So it seems that our high self-esteem participants were able to reap some kinds of benefits of connecting with others on social media, but for our low self-esteem individuals, that was not the case, right? Relatedly, if you are someone who have higher interpersonal skills, and we get to talk about what that might mean, but social media use can be beneficial. Here we found that for people with higher social skills or interpersonal skills, that is the blue line here, social media use, and this is looking at well-being outcomes. Now, higher on this axis means better well-being, so it's the reverse here. So again, what you see is that if you're someone with higher social skills, more social media use predicted better well-being. For those with lower interpersonal skills, social media use predicted lower emotional well-being here. So interestingly, though, these individuals didn't differ in terms of how much they used social media. So they're using it, all of them, a lot, but its impact on them was very different. So these findings do question this initial idea when that social media, when it first came out, even Mark Zuckerberg mentioned this too, that it was supposed to help those people who were shy or who were socially awkward or less skilled, right? If anything, these data seem to suggest the opposite, right? The socially rich gets richer and the socially poor gets poorer kind of framework makes more sense here. So that's something to think about as we are thinking about the role of social media use in our daily life. So I know I've thrown a lot of information at you. So to close out, I'd like to provide some broader takeaways. And I find it useful to have a metaphor whenever dealing with a complex topic. And the best one I've seen so far is the donut analogy by Van den Abel and colleagues. Yes, if these donuts look familiar to you, they're Paula's donuts. Anyway, this might help us better think about the impact of social media use consistent with empirical evidence. So a donut, may not be the best source of nutrition, but whether it is bad for a person and how bad depends on the characteristics of the person and the context. So here we go. So first, we know that eating too much, is probably not good, right? But moderation, right? Moderate amount is not going to drastically change your life for the better or the worse, right? But similar to the displacement idea, if donuts, right, it's a substitute or displaces nutritious food, it may lead to some issues. So think about what it is actually doing. Second, the how matters too, right? Eating donuts to cope with stress or forming an excessive donut eating habit in response to interpersonal or mental or school problems can be problematic. You might feel good in the moment, but it's not resolving the very issues that's causing the stress in these issues, right? But as an occasional thing, maybe dessert, maybe in the morning, right? It's something pleasant that can be shared with other people. No harm there for the most part, right? And we know that active use is generally better than passive use. So again, the emphasis is on how you engage with this technology. And finally, some individuals may be more vulnerable than others, right? If you have pre-existing health condition like obesity, right, you should be more vigilant, right? But if you're physically healthy, right, a moderate amount, again, shouldn't really impact you that much, right? Similarly, in a previous slides, right, we're seeing that people with some risk factors, right, depression, loneliness, low self-esteem, or anxiety, right, they may be more vulnerable to the potential detrimental effects of social media use, right? Another question to consider, I think it's a more broader question, is that what about those whose only food option is a donut, right? If you live in a food desert, right? So how should we think about kids who do not have the social resources available to them, right? Chances are they're going to turn to social media more, but whether that is effective, the evidence isn't as strong. Yes, this gives them the access, but how effective is it? That's, I think, a future research question as well. Speaking of future research, I should also say that the quality of studies that you will see will be drastically improved in the next several years with a lot of these methodological improvements that specifically allow researchers to go beyond screen time. So number of hours spent on social media. We know that social media experience is a lot more complex than that. So these improvements will allow the researchers to get a richer understanding of people's social media experiences moment to moment basis. For example, social media companies do allow people, the users, to download their own social media data, which contain a lot of details of their use. So in Europe, researchers were able to conduct studies based on such data donation by their research participants. Currently, we can't, do that. But again, there's measures being put to help this. We're also using an app, phone app with consent, of course, that could unobtrusively record social media use and link it with daily movement and sleep data and health assessments, right? The wearables are being really improved, the technology and the accuracy. So we're ready to incorporate that into research studies. And finally, this is fascinating. Researchers at Stanford have also developed an approach called screenomics, where they could capture screenshots automatically, again, with participant consent on the phone, right, every few seconds, and train AI to quantify and analyze different social media use patterns. So I'm hopeful that the next generation of research in this topic will provide a deeper understanding of the role of social media use in well-being, and with some insight into how we could best utilize this technology. All right, with that, thank you so much for listening to me. Yeah, this was already fun for me. Thank you.
Well, Dr. Lee, thank you again for sharing your expertise. Like I said, it's interesting for me, and it was interesting, as I was kind of coming across. So just for those watching, if they care to know kind of how this started, I was just kind of interested in some of this, if there was research around this topic out there. And I happened to come across Dr. Lee's research and then saw that he was right in our backyard at UB. And I was like, oh man, this is amazing. So thank you again for just being willing to do this. And I hope those who are watching, and I hope our community understands the benefit that this is to our community. This is not something, there's people that you can only access this type of information by attending UB or going to a class and doing that. So the fact that we have people who are experts in the area, in the areas that we're looking to educate on, who are willing to, provide this type of support for our community is really valuable. A couple things to kind of close out that I wrote down, that to me, looking at our office in particular, and a lot of the direct supports that we provide, and the direct mental health supports that we provide, the two things that came up in your research that you were talking about that I found most notable as it relates to our young people are the kind of that who, right? So who is impacted the most? And you're talking about that 20%. And when we look at those two aspects, so self-esteem and interpersonal skills, and the people that have the lowest amounts or the lowest levels in those
Yep.
areas were the most negatively impacted by higher degrees of social media use, I think is profound to understand.
Yep.
Because when we think about some of the students that are coming into our office, um, for sure, some of those are students that have kind of more more significant and profound mental health needs that have kind of been there for a
Yep.
long period of time.
Mhm.
That might have genetic components involved as well, or students that might have experienced significant trauma. But we also have a handful of students, and I would say more than a handful, a pretty substantial percentage of students and young people that are meeting with therapists in our office, but who don't kind of fall into those other categories of longstanding trauma, longstanding mental illness, but
Mhm.
who are
Mhm.
in that moment or during this particular school year really struggling with mental health.
Mhm.
Um, and when I look at a lot of those students, the idea of low self-esteem, low interpersonal skills are definitely prevalent. And like you said, knowing that there might not be as many alternatives for those students to engage socially outside of social media, I think is really problematic. So, um, with that being said, like, to what extent do you think that schools, I could even broaden that to communities at large, but to what extent can schools in the K-12 setting better support healthy habits with social media use and screen time? And how can we more intentionally do that, in particular with those students who we know might be most vulnerable um, to the impact that that can have on their physical and social emotional health?
Yeah, I mean, this is a really important and also difficult issue to tackle. And then I should probably mention today a lot of what I talked about was one directional, meaning social media use's impact on well-being and physical health and depression and so forth, right? But there is also a lot of research showing the other direction is also true as well. So meaning that people who are depressed are more likely to turn to social media to for whatever reason. So you could see that there's this bi-directional link that maybe depressed individuals will turn to social media more, but they also happen to be more vulnerable, right? So they'll use social media use and they'll use social media more and have uh, consequences for their how they feel, right? So that's a cyclical thing that can be very damaging. So I think in general, it's difficult to tackle this, but we do know that I think if I were to say very broadly that right now I am not convinced that the basic psychological processes or the social interactions that we have online are drastically different from what we know about how it goes on offline. Okay, so we already know, from research, but also parents and staff and others know how offline interactions are like, right? Who are more vulnerable? What tends to happen? What's good? What's bad? So to me, that the initial idea that social media is a completely different space, it is different, but I think the same fundamental psychological processes apply similarly in that space as well. So we know that we already knew that self-esteem, that role of self-esteem in offline interactions and in relationships, right, translates, it's not actually surprising that you found that effect on social media. So I think what we can do is maybe, I'm not saying that, reduce the focus on social media, but we know what's good in offline settings. So I think one thing is to really look at that. And another thing is to, right, we'll should continue to monitor, uh, you know, uh, students' usage and things like that. But it's not just overall amount. It's how you use it and why you and when you use it, and be more purposive, right? Have some purpose, because social media can be good for certain things if you have a clear goal. Another thing I want to mention is this idea of displacement. There's a lot of talks about, okay, so if we take away the phones or if we reduce time spent on social media, what are we going to replace that with, right? So if you, in a natural setting, people typically, if you say no social media, what's going to happen is their internet usage goes up, right? Their TV or Netflix, other media, sort of, entertainment media goes up. So what we replace that with, if we were to have this right implementation in life, right, is very important. And here's where I think we could be creative, or there's better talent out there with teachers and parents about how to create this offline space more creative and fun. Easier said than done. And this is not something that you haven't dealt with before, right? But that's where that comes in. Just simply saying no probably not going to drastically change our youth mental health. This is my opinion.
Yeah, and I think that, the idea, I like looking at it as online, offline spaces. And I think the idea of, you know, creating, if we know that there is so much time being spent online, and obviously there's, based on your research, some detrimental impact to that, we have to do a much more intentional job of creating offline spaces that are both, healthy and beneficial to students, or young people or older people, but also that are enticing enough for people to want to participate in. And I know, one of the things here in Clarence, for better or for worse, we're an extremely high performing school district, by and large, with a lot of really competitive after school and extracurricular activities, which is, again, it goes back to those high level interpersonal skill, high self-esteem students. They thrive in that environment in many cases. They thrive in that highly competitive um, environment where there's a lot of responsibility. But for our students that might be experiencing lower self-esteem, lower interpersonal skills, those types of extracurricular activities, community-based activities, are probably overwhelming, and probably are not as inviting for people that might be experiencing lower levels of self-esteem and interpersonal skills. So again, if we're taking away, or if we're clearly saying, broadly,
Yep.
social media use is probably, like you said, undermining well-being, if we're not introducing activities that are meeting people in particular that are most vulnerable, having lower self-esteem, lower interpersonal skills, if we're not meeting them where they're at with
Mhm.
extracurricular and community-based activities, we're really creating a void,
Yep.
that probably is going to make things even worse, and those students might actually, potentially go further into their social media use if no other options
Right.
are given, which is what I think we see sometimes anecdotally. So with that being said too, I'm thinking about, again, as I was telling you, I have an 18-month-old at home who we've really tried to do a good job of not having, any screens on or around or exposed to outside of like FaceTime, which is what the recommendations are. But what do you recommend to parents and caregivers, especially of really young children who might just now be starting to think more critically about the role that they want social media, or just smartphone use or screens to play in their child's life? Like, what recommendations would you have, kind of outside maybe of that moderation?
Yeah, yeah, and it's an important point. And I want to first say that parents are in an extremely difficult situation. I'm not a parent, but I could, I know this from anecdotes and conversations, because they deal with this every day. And they're given very limited amount of resources, right? And that's why I appreciate this type of conversations that we have today. Our young children are also in an extremely difficult situation, and they're the ones that are actually at the forefront, right? It's their mental health. Although there's research showing that parent mental health is actually had been declining as well. So this is something big. I think I would say this is something bigger than social media,
Mhm.
that we need to have a more holistic approach as well. So I think your question, I think you mentioned a key phrase. It's thinking critically about the role of social media, and I think hope some of the message today help us to start thinking about this. But we should probably get away from the good bad framing. You know, Kids know they're actually they're on it more than us, and they know the goods and bads. It's more nuanced, right? So it's if moderation is key, we should probably talk about how you use it, why you use it, when to use it, for what, right? And I think that starts to build towards this digital literacy that is emerging right now. I think it's a little bit too preliminary. But do focus on monitoring not just how much you use it, but how you're using it. Talk about it, why you're doing that. Sometimes you just you just reach out to the phone because that's the most accessible available ones, right? So maybe there's some reasons so talk about those, and that parents have a good sense of, or teachers and staff members have a good sense of what type of sort of individual characteristics of the students, right? Whether they're self-esteem, another thing, anxiety, another thing, right? So then you know that for those students that you want to be more sort of careful and vigilant about their usage as well. Yeah.
Yeah, do you think, and this might be putting you on a spot that you don't have any background or comfortability with, but just thinking about kind of the public perspectives of social media use, screen time, all of these things, do you think maybe in your like when you meet with your college students and you're talking about these things, like do you envision a future? Because I know in certain pockets there are these like new like neo-Luddite um, groups that are abandoning
Yep.
smartphones.
Yep.
Do
Mhm.
you ever do you think there will ever be a situation where because again you put out all this research, right? You do all these things, highlighting some of the obviously pros but significant cons to some of these pieces of technology. Like, do you think that there's ever going to be a situation where a younger generation might say, you know what, like we've looked into this, and or parents of younger folks, and where we kind of go back a little bit to I guess a simpler use of technology and a simpler use of social media as far as how it's integrated into our lives? Do you think that's going to happen, or do you see this just kind of do you see us having to adapt more to the reality of this being more prevalent in our life?
Yeah, I also, in doing this type of research, one thing you try to do is, keep your optimism. There's always this temptation to be cynical. Uh, I'm not sure. Another question to ask is that, we haven't talked about today is the role of the social media companies.
Mhm.
It doesn't seem like they're gonna let things go. All right. So I wonder, there might be small pockets of individuals who will try this and have some success. But we know that this fear of missing out, especially when it's social experiences, it's a very strong motive for especially adolescents, but college students and so forth. So with that said, maybe, it's just like sort of if you could take a break from time to time, that's enough to have some sort of benefit. And that's sort of part of this, I think, getting more awareness and, the digital literacy things that are coming up nowadays. So, yeah, so there might be some solutions. I'm hoping that, research is part of that solution. Uh, so that's another thing, and maybe I'll throw this idea out. Things might change. As I mentioned early in the talk, that we had the similar reaction when first the telephone came and the books came, a newspaper, right? Every time this new digital or media technology comes around. So in 10 years, we might just be talking about, hey, remember the times that we had social media and that was okay. Now we're dealing with AI and all this
Yeah,
other type
something
of newer
else.
technology. It's interesting times, but we have some historical precedent. But whether social media and AI, for instance, are completely different from previous years, that's another question that a lot of researchers are dealing with.
Yeah. Well, and I think, to kind of close that, I think the important thing to probably consider, given that historical context, is that in that same time frame of the past 300-400 years, maybe even 1,000 or more years of technological advances, there have been tried and true ways over time that cultures and communities of people have benefited their mental health and their physical health. And getting outside into nature,
Yes.
finding time to spend physically in the presence of people that you love and care about,
Yes.
and getting, proper exercise, nutrition, have all kind of been, as long as we have
Yep.
been on this earth as
Yep.
humans, some tried and true ways of doing it. So I think that's the other piece that I really hope that, for anyone listening as a parent or a caregiver or a school staff can kind of remember, is that while all of this technology is new, how to stay healthy has kind of been, there have been some blueprints over the course of the past many centuries and millennia, um, to kind of look off of and say, okay, you know, getting outside seems to always have been a part of many cultures, and that's kind of helped us sustain being, having opportunities to engage with family, with friends, with loved ones, and making sure that there's more time maybe spent with that than there is scrolling on TikTok, probably can have a benefit. So that, there is a blueprint, I think, for how to move forward,
Yep.
even with social media being present in our lives. So Dr. Lee, I want to thank you again. I'm really glad that you were willing
Thank
to
you.
do
Yeah.
this, and I'm
Of
glad we
course.
connected, and hopefully we can keep collaborating. I know there's got to be uh, some students here at Clarence High School I know that would be totally interested, who I know
Mm.
are want to go into psychology, want to go into the
Great.
medical field, that I know would be totally interested in hearing a little bit more about your
Mhm.
research. So
Mhm.
don't ever hesitate to reach out. And again, thank you.
All right. Thank you so much. All right. Well, it's fun.